This is Duncan Turner from the Vagina Doctor podcast. Welcome to the Consult With Me segment where we take a deeper look into our most frequently asked questions. But what do I know? I'm just a vagina doctor. Hello.
How are you?
Good.
Okay. Good.
Good.
So I'm just surprising you today with the Consult With Me. We didn't really chat about it first.
No, we haven't. So I have no idea what you're going to ask.
Right, I know. But it's a common thing. And it is ablation. And I say it with a smile because there's a lot of opposing opinions about ablation. Yet it seems like many women in their mid-40s, when they're going through the beginning of all the hormonal changes, a lot of bleeding, they get an ablation, right?
Yes.
And so they stop bleeding, but yet they still have the PMS symptoms, but they're feeling better in the sense because they're not bleeding to death every month.
Right.
And then there's other women who are just like, no, I am not having an ablation. And they're just adamantly against it from things they've read or things they've heard about ablation. So I just want to kind of go over that from your perspective.
If you ask me what an ablation is, I can tell you that it's a treatment to the lining tissue of the uterus to destroy most, or not, if not all, of the endometrial cells, which are the cells that bleed during a period, or in some cases after menopause, because of small polyps or small lesions in the uterus. None of that's very serious. Very occasionally, abnormal bleeding can be because of a pre-malignant condition, something that could become cancer if it was left untreated. And that's why with hormone replacement therapy, we always use progesterone as well as estrogen, because that decreases that risk. If you do an ablation, there might be some scarring in the uterus that seals and prevents that initial first warning sign of bleeding that can happen with a precancerous or a cancer situation that may just not be recognized early. And that's the only serious complication of an endometrial ablation, is that we may lose the warning signs that there's something more serious going on.
And is there any way to sort of look at that if you know a woman's had an ablation? Like, is there any testing that
Nothing that's particularly reliable, because one of the things, if somebody has some irregular bleeding, one of the things we look at is ultrasound of the endometrium. And that, if it's really thin, it's very unlikely for it to be anything serious, but it might be thin just because it's been ablated, and that there is still a problem there.
Yeah.
So it doesn't. That's the only concern about endometrial ablations, is that it may mask a warning sign for uterine cancer in the future. But it's honestly, this is the procedure. Endometrial ablation it surprised me at times, because I would see patients, walking down the street, and they'd stop me and say, "You saved my life." And the story then would be often, well, all I did was an endometrial ablation to you. I gave you back a life because you were losing days of work or being disabled for extended period of times on a regular basis. And I wondered why the people that were stopping on the street were saying, "You saved my life," when that wasn't strictly true. I just helped them a lot.
Yeah.
Whereas there are patients that, had cancer, that they didn't have any cancer anymore because they did the appropriate surgery, or they had infertility and they now have children. Changed their lives significantly. But the people that were more likely to say something, "It changed my life," or "It saved my life," were the people I was doing ablation on. And the only way that I could really rationalize that, and I talked to a few patients about it, and I think that the radical change from heavy, debilitating bleeding to very little or none was such a huge change for these people with a very, very small price attached to it, meaning minimal discomfort, no preoperative treatment necessary, no major surgery necessary, no major risks, and no major postoperative problems. So they were exaggerating what I'd done for them because it was such an easy thing to do.
Yeah.
So, but I don't see people that are adamantly opposed to ablations. They would say, well, do I really need to do that? Or I just want to have a hysterectomy. But most insurance companies now will not authorize a hysterectomy without a trial of an ablation.
Yeah.
So it's something that if patients are concerned about it, that's the only significant downside, that it could mask that. And the chances of that happening are very, very small, but they're there.
Okay. Thank you. Thanks for listening. And if you have more questions, please let us know either by email or DM us on the Vagina Doctor podcast.
See you in the next episode. The Vagina Doctor podcast. It all starts here.